And if you have a lot of questions about the vaccine and the process of how to get it, you're certainly not alone. So we took to our Arizona's Family Facebook page asking, what do you want to know about the vaccine?
And we are working to get those answers for you. So this morning we're joined by Marcy Flanagan, who is the director of the Maricopa County Department of Public Health. Marcy, thank you so much for your time today.
So Marcy,
thank you for having me.
So there's a lot of questions out there. One of the things I was reading is don't rush out to your doctor to try to get the vaccine, because for most of us it will be months. But one of our viewers, Randy Stroop, wanted to know, how do we find out what group we fall in?
That's a great question, Randy. And you can always look on the maricopa.gov/coronavirus website. Also, just to give a quick timeline, if you are a frontline healthcare worker, you're going to be in this phase 1A. And as it was previously mentioned in the segment, you should have received information from your employer or from our listserv of all healthcare individuals of how to go through that process to register. Phase 1B, you're going to be critical workforce. That's going to be our educators, our law enforcement, and high-risk individuals over the age of 65. And that's probably looking a few months from now, probably February, when we start reaching out to those groups. And from there, you can kind of start to see where you're going to fall. After that, we're going to move into high-risk individuals in the general population, looking around March. And these are just very vague guesstimates at this point, depending on how much vaccine becomes available.
Marcy, we spoke earlier with a local doctor who said his colleagues and he were making their appointments for Thursday beginning and were feeling very enthusiastic and kind of uplifted over the prospects ahead of them. So they were really feeling good, and it was a boost they needed. Lester Tinney, who watches 3TV, asks, why does anyone need a vaccine when most people recover from COVID-19? Marcy, how do you explain that?
So, luckily, most people do recover. The importance of a vaccine is that we don't continue to see this widespread community spread that's overwhelming our healthcare system. We know that our bed capacity in hospitals is the lowest point it's been since this pandemic in Arizona, lower than it was in the early summer months. And so we can't overwhelm our healthcare system, because important procedures, individuals that really need life-saving care, are not able to get into a hospital if it's overwhelmed with COVID patients. So where many patients recover, not all patients recover. Unfortunately, we have seen thousands and thousands of deaths in Arizona and even across our nation. And so just like any preventable disease, we want to prevent this from spreading and prevent individuals from having to go through the horrible, repercussions of having COVID.
And Marcy, here's another question from a viewer. Jean Fleck wanted to know, where will the vaccine be administered, and how does one go about getting an appointment?
So it depends on which phase you're in. This phase 1A, which is for, again, our frontline healthcare workers and those that are most at risk of coming into contact with individuals who are COVID positive, they will receive information on how to register and schedule themselves for a vaccine. That process is going to happen at only 5 locations in Maricopa County for the next several weeks. When we start moving into phase 1B, which is expanding that population to our educators, our law enforcement, some other critical workforce, you're going to see more of a hybrid model. You'll see some of those pods continue to operate. Those are those point of dispensing that we have right now. But we'll also start to expand, and you'll see some pharmacies that have the vaccine available. But it'll probably be several months. I'm talking early spring to late spring, until you'll be able to just go to an outpatient provider like a urgent care center or your primary care physician to receive the vaccine.
So as we wait for that, it's important to address the other issues with this pandemic. So Marcy, how is contact tracing going in Maricopa County? And are you able to kind of narrow in on some of the businesses or types of venues that may be leading to community spread?
So when we get the type of numbers we're seeing lately, yesterday was over 5,000 cases, the day before 5,000 again. So when we start to see those type of numbers, the work that we do in case investigation and contact tracing not only becomes more difficult, it becomes less effective, because individuals are have a hard time remembering everyone they came into contact with during their infectious period. We also have some individuals that are a little resistant and reluctant to tell us everyone that they were in contact with. So as we see more and more people become infected with COVID, the harder it is to try to contain it. And so that's why staying safe, wearing your mask, only going out when necessary, limiting your social gatherings are really important. A lot of the cases we're seeing recently are individuals that have thought that they were kind of keeping their bubble a little bit small, but maybe had a few extra people over for the holidays or went to a social event. And I think that everyone is just in that mode where we're COVID fatigue. We're tired of being in this state of not being able to be around our loved ones and our friends and our family. And so a lot of what we're hearing is just some decisions that were individuals made to be around a few more folks than they were maybe early on in the pandemic that's led to these numbers we're seeing.
Well, Marcy, thank you for your input this morning. We appreciate your time, and it sure helps to answer all the questions out there.